Assalamu alaikum Nazreen. Welcome to my channel. I hope that all of you are fine. In the previous video that we are learning about the US insurance. So, we will proceed our topic with the same thing that we know about the medical insurance. So, we open the same website and get the more information about the medical insurances, and we will get the benefit from this information. Okay, so we are here trends in private coverage. The proportion of non elderly individuals with employer sponsored cover fell from 66% in 2000 to 56% in 2010, then stabilized following the passage of the Affordable Care Act. Employees who work part time, less than 30 hours a week, were less likely to be offered coverage by their employer than were employees who worked full time, 21% versus 72%. A major trend in employer sponsored coverage has been increasing premiums, deductibles, and co-payments for medical services, and increasing the costs of using out of network health providers rather than in network providers. Trends in public coverage. Public insurance covered from 2000 to 2010, in part because of an aging population and an economic downturn in latter part of the decade. Funding for Medicaid and CHIP expanded significantly under the 2010 Health Reform Bill. The proportion of the individuals covered by Medicaid increased from 10.5% in 2000 to 14.5% in 2010 and 20% in 2015. The proportion covered by Medicare increased from 13.5% in 2000 to 15.9% in 2010, then decreased to 14% in 2015. Status of uninsured. The uninsured proportion was stable at 14 to 15% from 1990 to 2008, then rose to peak of 18% in Constant 3 2013, and rapidly fell to 11% in 2015. The proportion without insurance has stabilized at 9%. A 2011 study found that there were 2.1 million hospital stays for uninsured patients, according to 4.4%, $17.1 billion of total aggregate patients' hospital cost in the United States. The cost of treating the uninsured must often be absorbed by providers as charity care, passed on to the insured via cost shifting, and higher health insurance premiums are paid by taxpayers through higher taxes. The social safety net. The social safety net refers to those providers that organize and deliver a significant level of health care and other needed services to the uninsured, Medicaid, and other vulnerable patients. This is important given that the uninsured rate for Americans is still high after the advent of the Affordable Care Act, with a rate of 10.9% or 28.9 million people in 2019. Not only is this because the ACA does not address up for gaps for undocumented or homeless populations, but higher insurance premiums, political factors, failures to expand Medicaid in some states, and ineligibility for financial assistance for coverage are just some of the reasons that the social safety that is required for uninsured. Most people who are uninsured are non elderly adults in working families, how low income families, and minorities. Social safety net hospitals primarily provide services to these populations of uninsured. For example, California's public health care systems are only 6% of the hospitals in the state, yet provide care for 38% of all hospital care of uninsured in California. 123,000 of which are homeless and 3.6 million of which live below the federal poverty line. So I hope you like my video, and the next we will consider the topic death and check about the insurance. So subscribe my channel. Take care. Have a good day. Bye bye.